The Department of Education just removed nursing from its list of professional degrees. What does that mean? It means that in the eyes of the government, the nursing program doesn't require as much funding as some other program. If you're already a nurse, this shouldn't affect you. You still have your license. But for aspiring nurses, you're going to receive less money. It's almost like the government hates healthcare. Let's talk about what happened, why this matters, and what the future of healthcare looks like in America. This is Journey to the Bag. Here's what went down. As a part of implementing Trump's One Big Beautiful Bill, the Department of Education was forced to basically list out what programs qualify as professional degrees. Why does this matter? Well, according to the new student loan rules, professional degrees are entitled to up to $50,000 per year and a $200,000 lifetime cap. Regular degrees are limited to $20,500 per year and a $100,000 lifetime cap. That's a huge difference, especially when these programs can be $60,000, $80,000 to $100,000 just to complete. What made the cut? The Department of Education determined that only these programs qualify as professional degrees: medicine, osteopathic medicine, dentistry, pharmacy, optometry, veterinary medicine, law, podiatry, chiropractic, theology, clinical psychology. What got left out? Here's what was notably excluded: nursing, master's and doctoral nursing programs, nurse practitioners, physician assistants, physical therapists, occupational therapists, audiologists, speech language pathologists, social work, public health, education degrees, including teaching masters. It's almost like everything except for a doctor when it comes to healthcare was excluded or just left out completely. When asked about this, the Department of Education press secretary claimed the criticism was fake news, saying that the definition has been clearly defined for decades. That might not be the case though, because the 1965 federal regulation defined the category, and it's not limited to things on this list. It's flexible. But now the government has made it rigid, and nursing got cut out. The new policies take effect on July 1st, 2026, unless something changes. Let's talk numbers. How much does it cost to get your master's in nursing? All right, average, $30,000 to $100,000. Top programs like Columbia could run you $140K plus. Even public universities range from $35,000 to $40,000 just to get your master's. How much does it cost to become a doctor in nursing? The range is anywhere from $63,000 to $172,000. Private schools can charge anywhere from $28,000 to $43,000 per year. Top schools like Johns Hopkins, Duke, Vanderbilt can charge anywhere from $60,000 to $75,000 per year. When it comes to nurse practitioner programs, if you wanted to jump from bachelor's to master's, that's anywhere from $81,000 to $185,000. For a bachelor's to a doctorate, that's $26,000 to $254,000. For a master's to doctorate, that's $17,000 to $170,000. Now here's the math problem that students face. Under the old system, the Grad Plus, students were able to qualify for the total cost of attendance. Under the new system, if nursing qualified as a professional degree, they were able to get up to $50,000 per year or $200,000 lifetime. Now that nursing is not considered a professional degree, it's capped at $20,500 or $100,000 lifetime. So if you're at an institution that charges $60,000 per year, you're only going to be able to get $20,500 for funding. Where does the other $39,500 come from? You got to get private loans with higher interest rates and less protections. Maybe your parents saved up a bunch of money for you, or you stashed a bunch of money from working before you became a student. I don't know. Or you can just, not become a nurse. I'm seeing a lot of videos and posts of nurses that feel some kind of way, as they should. You go to school for 10 years, you rack up $200,000 worth of debt, and the federal government can now come out and say your degree isn't professional. Almost like you don't matter. What is up with healthcare in the US government? We have a nursing shortage problem. The US needs to fill 193,000 registered nursing positions every year up until 2032. Right now, there's a projected shortage of 295,000 registered nursing positions. Over 100,000 nurses left the field completely during COVID. And nearly half of the nurses are over the age of 50, approaching retirement. This is a problem. In rural and underserved areas, there's a shortage of doctors, and nurses help to fill that gap. They perform a lot of similar duties. They provide primary care, prescribe prescriptions, perform procedures, deliver babies. They're very important. The impact of this should be simple, should be clear. You're gonna have less students enrolling in nursing because they can't afford it. You're gonna have less nurses in general. You're gonna have less teachers because you have to have a master's in order to teach nursing. So that's gonna go down. And then, of course, you're gonna have health problems. You're gonna have higher mortality rates, more infections. Healthcare is gonna go down the drain if you don't have enough workers in healthcare. And let's remember, nursing wasn't the only thing excluded from this list. A lot of things like teachers, a lot of other fields related to health in general, public health, social workers, physical therapists, all of these things that were considered essential a few years ago are now qualified as not professional. Now, I'm not saying that foot doctors or chiropractors aren't professional or valid, but I do feel like some fields are more important, more essential than others. And this one, nursing, should be a no-brainer. What can we do? All right, if you're a parent with an aspiring nursing student, I hope you got your money right. You gotta get your money right. Invest. Have something ready for your college education. All right. Look for scholarships. Look for hospital-sponsored education programs. Look for state-funded education programs. You might have to do military. The government doesn't seem to care, so you gotta get your money right. We already have a healthcare system that's broken. People can't afford healthcare. People can't get the care that they need. And I guess the solution is cut funding everywhere, make it harder for people to become nurses, make it harder for people to become healthcare workers. Hopefully we'll figure something out. None of this is set in stone just yet. We have till July 1st. Let me know what you think. Drop a comment, like the video, share the video, subscribe. Remember, the world is yours. I appreciate you for watching. Catch you on the next one. Peace.